Hello, it's Elizabeth here at the Dandelion Soap Herb Shop. We're talking about inflammatory breast cancer. Today's video is about the 1 week mark from the first cycle of chemotherapy and some of the symptoms I've experienced along the way and what you may or may not experience yourself, but can anticipate and know what's going on there. Maybe make you feel a little bit better about it, and what, kind of like, all right, that's normal, or maybe that's not normal. So today I arrived, I was very, very fatigued, and I really was encouraged by my husband and friends who said, yes, definitely go get the fluids, it'll make you feel a lot better. And I have been struggling with chronic fatigue. So I will give you the breakdown on that. But just know you can see my response. It makes a difference. I feel like my old self again. I've got my energy back. I felt good. I've been talkative and excited. And I just, feel like myself again. I felt like I can go do this and I can get this done and I can do this and get this done. And I haven't felt that way in a while. Now, when I took my chemotherapy, the day I woke up, the next day, uh, on day one, I was in a great deal of pain. I mean, intense pain, unlike I'd ever had the whole time. I had not felt that kind of pain. And it was like my breast pain was more of an open wound that the oxygen is hitting it. So it is, a very, very intense pain, like a severe injury. And I was concerned if that is normal. I took myself down to the clinic because I had to take the growth injection shot. And I probably shouldn't have done that, but I did. And maybe just the activity of moving this arm and everything that's been done, that in, irritated it as well and got it more and more irritated. And I expressed to the nurse when I got there, some of the things that that I had this severe, intense pain. She didn't read a lot into it, but she thought, okay, if the condition of the breast has changed, which mine became more softened and the lump wasn't as firm and hard, almost like it melted per se, like it just like gave way. And so that was one of the changes I had indicated to her as well. So I woke up, I'm in severe pain, but my breast is kind of not hard and firm like it was. It's like it kind of melted a little bit. And then, of course, I had my lump that I could feel, but the overall feel of the breast was softer. And it wasn't like I had been dealing with this rock. It was more like it had melted, like it had somehow. And like I said, the knot just wasn't, rock hard. But that pain got worse as the day went on. So by the time I got my injection shot and drove back to the house, I was at a 9. Like my pain was seriously the worst it ever been, at a 9. So at that point, I am just trying to get some Tylenol in me, get some food in me, and get the pain to calm down. That's all I wanted. Just please calm down. Since then, that pain went away. It finally died down. I got the Tylenol to take hold, and it calmed that pain. And then the next day, no pain. The next day, no pain. Next day. But on the fifth day, I had like these little bitey pains, and it was like a ache, like it was just like a ache up here in my chest, and it was just really nagging on me, just aching, and just, it just went back off. So I had to take Tylenol. Now, bear in mind, if you do have pain, you probably want to express them your pain so they can give you a pain medication versus you taking Tylenol. And the reason why is because you have to monitor your body temperature. You want to do that every so often throughout the day from the time you take your chemotherapy on out. Because if you are running a fever of 100.4, you need to notify them right away. So 100.4. If that registers on that thermometer and it doesn't decline and it stays that, you need to let your oncologist know right away, because that means that you must have an infection, some kind of bacteria going on, and they need to address it immediately with you. They have to take care of you right away. That's like serious, very serious. So don't ignore it, and make sure you have a good thermometer. I got an infrared digital thermometer. I will make sure that I put a link to it in the description box down below. I got mine from Amazon, and they're like $10, and they will keep a memory as well, so that if you are actively monitoring it. That particular monitor, infrared thermometer, you just hold it within an inch of your head or body, and it will register your body temperature. It will also register surface temperature, as well as the area temperature. And that is good for if you are doing some type of therapy where you need to be able to be accurate on the temperature. When you do chemotherapy, it's important that you want to eat your food at room temperature versus it being scalding hot, or cold is okay, but you're better if you have it at room temperature as far as regular foods you would commonly eat hot. And the reason for that is some is one of the symptoms that I developed since I've had my chemo. I have the sores in my mouth, so like my gums down here is raw. My tongue has places on it, and they're like bumps, and they bursted, and so they're raw. And then I have raw spot on top of my mouth. So today they issued me Magic mouthwash, and it really is called Magic mouthwash. It is a compound, and I will express to you, if they can fill that order for you, or have you go to the hospital and pick it up, the prescription from the hospital, definitely do it, because it's like 36 bucks. If you have your local drugstore to do that, because it has to be formulated and then sent to them, or if they formulate it, it's about $400. Yeah. So trust me, $36 is a whole far cry and a lot better price than $400. So we got ours from the hospital. They've got had that made for us, so we could just go and pick it up. Then the other thing is, when I didn't trust myself to drive myself because my fatigue had been very, very chronic. And I was glad that I had my husband to take me. But trust me, go for the fluids. On that day, you'll be able to talk to the PA or your actual doctor, if you're taking yours at the same facility that they operate at, and not from a distant facility, because they'll take you, and you'll be able to discuss with them express to them some of your symptoms, and they'll be able to explain those away, or give a regimen to fix it and handle those side effects. They do not want you to suffer. They really want you to be comfortable during your treatment, and they understand how important it is that your care is the utmost. Uh, the rapid heartbeat that I had been feeling, to where it's beating so fast I feel a vibration. That's just kind of one of the things. They couldn't really explain that away. It's just they did ask me, did I have heart palpitations, and I said, well, I haven't had any palpitations, but this is my body on the inside is like I'm in a vibrating chair, and I can't turn the vibrator off, and I'm just like inside, and so it's like I can feel my heartbeat, and I just don't like that feeling. It's just ugh. But after I got the fluids, I haven't had that problem since. All of that has calmed down, like severely calmed down. None of that. I'm not feeling that vibrating. I'm not feeling my body actually rocking because of the vibration, the rattling inside. Um, I've had less shakes. Like I have a little bit of a shake in my hands um, during that week after the chemotherapy. Just and sometimes I would get like a cold chill come over me, and I'd be cold at first, and then eventually, it would pass, and I'd be regular. But I do seem to be a little more cold natured than I was before. I'm not cold. I haven't been cold natured since menopause, but now I do seem to get a little bit of a tendency to be a little bit, um, get cold and just want a little bit of cover on me, not a lot, just a sheet or something, or maybe a light throw. And I sleep basically with just a little light throw anyway. So the my worst thing was the chronic fatigue. Now another symptom that I had was I would get like it's almost like a migraine type. I mean, not a migraine, more like a sinus headache. But I knew it wasn't my sinuses, but it would just come on like a achy pain. So the Claritin generic of Claritin, that antihistamine, I'm going to try it, and it was suggested, so I'm going to try the antihistamine to treat that. And so far, it's been okay. It's working. So it's probably coming from the growth shot, which causes your bones to ache, and so just maybe just my sinus, my septic and all is maybe aching like a bone ache from that shot. But like I said, I took the generic of Claritin that seems to be handling that little mild headache. It would come on, but then it would pass. And it'd be gone for a long time, then it would come on, then it would pass. And also chalk it up to also the chronic fatigue. Um, the other thing that I had experienced, let's see, mouth sores, the rapid heartbeat, the little bit of shaking, and the mild migraine. So the fatigue, OMG, oh my gosh. So the second day after my chemotherapy treatment, my energy was still up, but then all of a sudden I had this plummet, like fatigue, like it's just started coming on, and it was just getting worse. And the third day, the fourth day, oh my goodness, it was just awful, awful. It was like dealing with somebody who's like massively drunk, who is almost incoherent. The thing is I could hear everything, I would respond to everything, but it was like my mouth didn't want to make the shapes. It was like I would get one eye open, and I couldn't get the other eye to stay open. Like I'm working, it was almost like being in a seizure and you can't get your stuff to work. Um, so I had expressed that. Now, when I ended up getting to talk to the PA versus the actual doctor, I really want to talk to the doctor. But once again, I had talked to the PA, who's who I talked to before. And, she gives me resistance. I don't know how to explain it to y'all, except that um, I feel sometimes I am judged at being a country hick, maybe a dumb old hick because of my southern drawl. Um, that because I am able to emulate and state exactly what it is that these side effects are happening, and based on the drug information I've been provided with and I've read, and it states that is a side effect, and just kind of running it across the individual, it offends them. This PA is offended. Oh my God, you must, anybody that seems to be more intelligent, God forbid that I might think that I'm as intelligent as she is. People like that irritate me. That's why I do the work that I do. I like to collaborate. I like to learn from the patient. I like to keep my mouth shut, my ears open, and they're going to teach me what it is that they need. And then that way I can be more efficient in what I program for them or suggest to them. Trust me, you want to learn your job? Keep your mouth shut, your ears open, and listen to the person who is expressing to you their need. They will tell you. They will be glad to. If you allow them, if you just let them, they will tell you how to help them. It is an easy task. Just be quiet. Listen to them, what they're suggesting, get their input, and then you can better come up with an analogy or prognosis as to how we can come up with a solution, working together proactively, collaborating to ultimately help each other. And it helps you vastly. But I did get really irritated, but I just smiled. Okay, okay, yeah, there, okay. That's what you do with people like that, because it's really all you can do. Um, and then later on, suddenly it's their idea. And as long as it's their idea and it's not your idea, they're okay with it. And that's just maturity. That's just immaturity. That's just people who are not mature. They have not grown. They have not lived long enough. And they have not experienced enough. So their immaturity butts into their common sense. And they get a little attitude-ish. And then they eventually go, oh, well, yeah, that's right. So, you know, I done figured it out on my own. Um, I should not have to come home and Google a damn thing. You should be telling me everything I need to know. You should be, and if you're providing me with the information about the drug, and the daggone drugstore is also providing me stuff about the drug, as well as the website is providing me stuff about the drug, then why are you disagreeing with what they're telling? They have to disclose that. It's federal law. They have to. FDA, regulated. They have to disclose to you the side effects. What they know can do whatever harm and which you can expect. And it drives me nuts that these doctors will literally look you in the face and go, "Well, no, you don't need to read all that. You don't need, that. That's just, huh." Oh, so you don't mind getting a law practice, uh, a lawsuit against you for malpractice? I mean, like, are you stupid? Like, if they're providing that information, you ought to know that. You're the doctor. You got the education. You know. Don't sit there and look at the person in the face and go, now you don't need to read all that. And yeah, but it's highly unlikely. I mean, they have to tell you that, but yeah. Yeah, they have to tell me that because it's a fact. It's a fact. Many people have died to gather that information. I think I'll take it serious, don't you? But that's not what you're saying to her, are you? It's not what you're saying to them. You're going, oh, yeah, okay, yeah, yeah, maybe you're right. Yeah, okay. All right, I'll play into it. But you know what? I'm going to do what I'm going to do anyway. Yeah, yep, that's me. I'm going to do what I'm going to do anyway. I'm telling you because I actually thought you might want to help me. But like I said, you've already told me stuff. And then, somewhere down the line, before the conversation closes and ends, and you're getting ready to go your direction, they're getting ready to go, all of a sudden they're on board and it's their idea. Okay, now it's their original thought. So they just took and fed back to you what you already done told them 30 minutes ago. But now it's a good idea because they told you. Okay, thanks. I'm telling you. It's not just my age, guys. I'm cynical. And I get worse as I get older because I see it. It's plain as the nose on your face. They really, truly, these individuals, multi-talented, factual, smart people somehow park their common sense out front when they come in the door. And they think that you are just some dumb hick. You're just a patient. You need to shut up. Yeah, when you're putting that poison in my body, I am going to be involved. I'm going to be proactive about what's going on. And I'm going to let you know that I know and I'm watching you. I am watching you. Because it's my life. It's my choice. And I need to be on board and you need to have me on your side. So you need to educate me about what it is that you've decided is a good idea for me, and then I'll decide if I want to trust that or not. Don't think that just because I'm coming to your doctor's office and you got some fancy title that I'm going to trust you, because you're human, and humans make mistakes. Now it's no there. There's no good science without science. You have to have the info and the data to back it up. And guess what? I'm a guinea pig too. Every person that comes in this door and talks to that person is a guinea pig. And I tell you right now, cancer is the biggest guinea pig of all. If you got any kind of cancer, you are a guinea pig. You may not want to be, but accept the fact. Your experience, your symptoms, the information that you share with them is going to help somebody. It's going to help you and somebody else. And most likely, the ones that go after you will benefit from it more than you do. That's the way it works. Carry it on. This research and the study and the consistency of going through that stuff is going to help someone else. So just be aware of that. And you know, with these PAs, if they're getting on your nerves like mine was getting on mine, I've already made up my mind. The next time I go and I have any things that I want to talk about or address, if I cannot discuss them with the oncologist, I will waver and go, no. If Dr. Douglas is not available, that's okay. I'll just wait until I come back. Or she can call me. You know, no. I'm just, because number one, this is the worst time for me to be dealing with stress. If you are a cancer patient, do not stress yourself out. Do not let them get you stressed out. Don't put up with the nonsense. Just don't. Don't put yourself under any unnecessary stress. And if I have to deal with somebody who is making me feel like I'm like, my symptoms or should be marked up as well, that's just that don't make any sense. Do you think I made it up? That's what my brain's thinking. Like, did I make that symptom up? Or if that just don't seem normal, for just having to have one chemotherapy treatment. Really? I didn't know there was a normal with chemotherapy treatment. Did you? I mean, that's what I'm thinking. I want to be a smart aleck to her. But that ain't what's coming out of my mouth. You know, it just seems to me that seems to be a little more intense than what we would anticipate after only having one chemotherapy treatment. Oh, so you dump poison into people on a regular basis and you don't expect none of them to have some kind of response. Because you're used to them keeping their mouth shut and doing what you tell them to do. That's what the difference is. Well, guess what? Now you've met me. And we don't work that way. But ain't what's coming out of my mouth. Trust me, y'all. There are times you glad I won't say nothing. I just keep it to myself. Because if you heard what I was thinking, you'd be going, I'm going to whoop that woman. I'm going to whoop her. I'm not kidding. That just drove me up the wall. She needs to spend more one-on-one experience in clinicals with actual chemotherapy patients, with actual cancer patients. She's sitting in an office, they come in there, they're getting their treatment. So guess what? She does not experience or see the suffering that a person dealing with cancer and going through chemotherapy, she's not seeing those in-between days and all the crap that we got to deal with after that treatment. It also seems to escape her mind. You're putting a poison in me to kill a cancer that's killing other good cells in my body, and you're expecting all of my organs to continue functioning at optimum basis and not and go without harm and no toxicity. None of that makes any sense now, does it? That's how much of a dimwit she is. Go spend some time at the hospital. Go talk to these patients. Go see what they're dealing with instead of sitting your pretty little self up here in this pretty little office in this nice little air conditioner and they just come in and out and you just get the appointments as they come in and out. You don't have to deal with them beyond this point. You get to talk to them and go, oh, what, that just don't seem normal after only one chemotherapy treatment. I could have, you know what I was thinking, right? Anyhow, moving forward. The other thing was the chronic fatigue. Guys, it was severe chronic fatigue from day 3, 4, into 5. And then it started kind of easing off, but but I would wear out. Now, when I say chronic fatigue, let me explain. I am talking that I cannot get my mouth to form letters. Like I'm talking, but you can barely understand what's coming out of my mouth because it sounds like I'm so massively drunk that you can't make out what I'm saying. Like my eyes, I would have one eye open and be trying to get the other one to stay open. Trying to get it open, like like I can actually feel myself pushing, trying to get that eye open. You're just like, you're just, you're just slumped over. You are so chronically fatigued, you can't. As far as trying to keep my balance and get myself, there were a few times when I really had to go to the bathroom and I could not just wait for that chronic fatigue to pass and would have to get somebody to just kind of chaperone me to the bathroom and then get me out of the bathroom and chaperone me back to my chair. Um, so, fortunately, I was fortunate that it only happened to me one time during my chronic fatigue episodes. Also, you're going to feel sleepy. So if you are chronically fatigued and sleepy, get into it. Let yourself sleep. I'm going to tell you that's going to be your best refuge to feeling better. Now, let me add this. They put a lot of weight on the stuff they prescribe to you. For example, this steroid. I have just heard they're preaching about that so much. So they're going to lean on the steroid to help give you energy and also fight off nausea. hmm So it's a dual action thing. Y'all, I don't want to take anything that I don't have to take to get over any of the symptoms, side effects. I really truly want to put as less of stuff in my body as possible. And I finally did agree to, okay, I will take one steroid once per day for up to 4 days after the chemotherapy. Because they're already putting it in me on the day of the therapy. But just the whole idea of taking steroids, and I'll tell you, I would eat the bottom out of the house. I mean, I would just eat the brick, the wood, and all. It's stuff, steroids were, and that's why I mean, I automatically gained 5 pounds only taking that steroid 3 days. That's like crazy. And I'm thinking by the time I got done with chemotherapy, I would be so obese, which is very bad. You do not want to gain weight, and if possible, you don't want to be gaining that weight when you're on chemotherapy, um, because then that puts more pressure on your organs, especially your heart. And you got to remember that toxicity is directly affecting your liver and your heart. So those are the two main organs that are commonly affected by the chemotherapy treatment is the heart and the liver. You have to keep an eye on the enzymes for the liver. So just be aware of those things. Those are some of the side effects I experienced. And in my first 7 days after chemotherapy, so 1 week from the day one of chemotherapy, cycle one of chemotherapy, and do get the fluids so you can be spunky again like me and have that little, piss and fire in you. So, that way you'll be fired back up, be ready to tackle the world and fight back and do whatever it is. Be tough like you are. Be you and be beautiful at being beautiful and being you, and don't let these quacks who want to be asinine try to make you believe that what you're experiencing is that's excessive since just your first chemotherapy treatment. That is BS. So let me add to that before I wrap it up on this video. As an herbalist and apothecary, I've always lived as natural as I can, eat naturally as I can, and of course, as drab as I look right now, I'm pretty looking natural. But I'm not used to taking anything stronger than aspirin or ibuprofen. And that means I take slippery elm bark, I take willow bark, I take um, feverfew, turmeric for my pain. You know, um, that I'm used to doing it all natural. So if I take aspirin or ibuprofen or the herbs that those are derived from, I had to use Tylenol when I started chemotherapy. It's really the only thing you can take for pain that does not interfere with the white blood cells, the blood platelets, thinning of the blood, or affecting the heart rate, your heartbeat. So it's really the only thing that doesn't interfere that you can take. So if you are experiencing pain, perhaps have your oncologist to get you something, maybe, a pain medicine that is not a fever reducer. And the reason being is you need to monitor your temperature to see to it that you've not contracted some kind of bacteria or have an infection. And you need to make sure it's like an infrared thermometer. It's about an inch from your head, and you can touch it, and it will scan and give you your temperature. If you have a fever of 100.4, so that's 100.4, you need to contact your oncologist right away. So get you the infrared digital thermometer to measure your temperature. I'll put a link to mine in the description box down below, the one that I use, I got from Amazon. It's my affiliate link, and that way you can find one that it'll do body temperature, also do surface and other the room. And so there are times when you're on chemotherapy, you need just to eat your food at room temperature. Um, I do have mouth sores, and that is why. Is because room temperature is going to not hurt that as bad. And so having the raw gums and on my tongue and roof of my mouth and right here on the front of my lip. So that magic mouthwash has got lidocaine in it, and it'll take care of that. Um, so these are just some things that you can expect. And that chronic fatigue was really, really bad, really bad. I mean, I can hear everything they're saying, and I'm responding to it, but I'm just like a drunk. Like I just have way too much to drink, and I cannot get my motor skills to work. And I'm extremely tired. Like walking from one room to the next, it's scary because I don't have good balance. Um, I'm just too tired. My body doesn't want to do it. So these are all things. And when you have a clean vessel that's not used to putting nothing in it, we're more sensitive. We have a clean vessel. You're putting chemotherapy treatment in it. You're having us take prescription medications that we've never taken. And as a herbalist and apothecary, and being the bridge for people and collaborating and coming up with something that's good and healthy for them to help them, I am not used to taking anything like that. So my body has not accumulated some kind of tolerance to any kind of prescription medication or constant taking of some kind of medicine. So it's going to be more sensitive. It's going to be more intense. The chemotherapy is going to affect me a lot faster than the average person. Just be aware of that. If you share the same as me and you've been natural and you don't put all that stuff in your body, it is not uncommon for you to have the same symptoms as me with intensity, and that your experience is a lot different than someone who has some kind of tolerance built up or who takes medications on a regular basis. And then the option of, if you do have pain and it's intense, perhaps your physician will issue you a pain medicine so that you're not taking a fever reducer. Um, and then, you know, you'll I know that it will get worse as the chemotherapies come about, so just anticipate that. But there will come a time when you'll finally adjust, because your body is now acclimating to that. The body is a very unique, wonderful, incredible vessel, and it will adjust. So my prayer is that as I take the chemotherapy, that my side effects will lessen and not get worse, and that my body will adjust to it better, and that I'll feel better. Um, so just I want to leave you with that. Don't think that you're not normal, because you are. In some things, you may be a little abnormal, as in you're experiencing something that's new and different, but you're educating them too. And you have that opportunity when you go to get your fluids a week later from your first cycle, that you can talk to the oncologist and or PA, and just make sure that when the nurse is asking you questions, you express to them some of the things that you've been experiencing, and she's going to get them on the case, and they're going to want to talk to you and address those right away. So thank you so much for watching the video. This is inflammatory breast cancer, the first week, and all that you can expect during your first week of treatment, including side effects and how you can confront those and fix them to better things in the future for your treatment. And if you have any questions or comments, be sure to leave them below and find dandelionsoup.com link in the description box, and you can find my name, phone number, and contact me that way if you really want to talk to somebody or ask questions or whatever it may be. And we're going to see each other on the other side. So this is Elizabeth. Take care of you.